Hey everybody, Dr. Inda here. Today we're going to be talking about treatment options for hormonal acne. This video is going to focus primarily on spironolactone as well as combination oral contraceptives as treatment options. So first things first, what is hormonal acne? This is a form of acne that often develops during the middle school or high school years, but is also seen in adult women as well. The most common things that patients with hormonal acne will notice is that it tends to affect the chin and jawline areas most prominently. In addition, the acne lesions tend to be a little bit deeper underneath the skin, and you don't see quite as much surface change because it feels like the acne lesions are coming from the inside out. One important thing to know is that hormonal acne can develop in adulthood, even in patients who've never had issues with acne previously. And in fact, in my clinical practice, this is something that I see quite often. The reason many women experience hormonal acne for the first time in their 30s, 40s, or 50s is that estrogens decrease during the normal aging process, and these hormonal changes increase the risk of developing acne. I find that it's helpful to break down treatment options for acne into 5 categories. The first category are topical treatments such as benzoyl peroxide or topical retinoids. The second category of treatments are the oral antibiotics. An example of an oral antibiotic that is used in the treatment of acne would be doxycycline or minocycline, or in some cases azithromycin. The third and fourth options for treatment of acne are combination oral contraceptives as well as spironolactone, which we're going to be focusing on in this video. The fifth option that we have available is Accutane, or isotretinoin is the generic name. Isotretinoin is the strongest treatment that we have for acne, and it's also the only one that has the potential to actually cure acne. What I mean by that is if you were to stop the combination oral contraceptive or spironolactone, it's very likely that your acne would recur. With isotretinoin, after you complete the treatment course, oftentimes the acne is gone for good. The trade-off with isotretinoin is that there's laboratory monitoring involved as well as monthly visits required while you're on the treatment course, which tends to last anywhere from 6 to 8 months or so for most patients. Combination oral contraceptives as well as spironolactone are options in both pediatric and adult patients. Now, in my clinical practice, there are a few situations where I found combination oral contraceptives as well as spironolactone to be particularly useful. There are many patients for whom a good topical regimen as well as oral antibiotics can't seem to keep the acne at bay. And since oral antibiotics are really only good for up to 3 to 6 months, we need a longer-term option that's both safe and effective. Both combination oral contraceptives as well as spironolactone are very good long-term options, unlike oral antibiotics. In addition, spironolactone and combination oral contraceptives require less frequent follow-up than Accutane, which requires monthly visits. In addition, many patients prefer the side effect profile to spironolactone or combination oral contraceptives as opposed to Accutane. An important point to realize is that both spironolactone and combination oral contraceptives are helpful while you continue to take them. But if there's ever a point in the future where you decide to stop these medicines, as is very often the case, there's a good chance that the acne will come back. So how do combination oral contraceptives and spironolactone improve acne? Both combination oral contraceptives as well as spironolactone reduce the effect of androgens on the oil glands in the skin. When there's less oil production in the skin, a couple things happen. Number one, bacteria that cause acne don't have a food source anymore, and so you don't get as many acne lesions. In addition, when there's less oil production, the hair follicles and pores don't get so clogged up, and as a result, you get fewer acne lesions. Now, oftentimes when I'm evaluating a patient in clinic who has acne, I'll often recommend that they consider starting a combination oral contraceptive before spironolactone. And I usually recommend this for a couple of reasons. Number one, while you're on spironolactone, it's very important that you not become pregnant. And this is because spironolactone interferes with the normal development of a male fetus. The second reason why it's often helpful to have a patient taking an oral contraceptive before starting spironolactone is that the oral contraceptives can actually reduce some of the most common side effects associated with spironolactone. For instance, menstrual irregularities as well as breast tenderness are both common side effects of spironolactone, and if you're on an oral contraceptive, oftentimes these side effects are far less noticeable. There are currently 3 combination oral contraceptives that are FDA approved for the treatment of acne: Yaz, estrostep, and orthotricycline. Although these are the only 3 oral contraceptives currently approved by the FDA for the treatment of acne, the reality is that any combination oral contraceptive can be expected to have similar benefits because they all have a similar mechanism of action, in that they oppose the activity of androgens on the sebaceous glands of the skin. Now, one of the really important points when considering using forms of birth control as treatment for acne is that combination forms of birth control, combination oral contraceptives, are helpful for acne because they contain both estrogen as well as progestin in the hormonal contraceptive. Progestin-only forms of birth control, such as the mini pill, Mirena IUD, or Nexplanon implant, often worsen acne. I often see patients in clinic who come in for evaluation and they've recently had a Mirena IUD placed, and they'll say, my acne has recently gotten much worse. Why would that be? And the reason for this is that progestins actually have androgen activity. And so because of this androgen activity, acne can worsen. The combination oral contraceptives work because they have that estrogen component. And that's really important to realize, because if you start the wrong form of birth control, it could have different effects on your acne depending on what hormones are in that method of birth control. There are several contraindications to oral contraceptives, such as a history of venous thromboembolism or a history of migraine with aura. So it's very important that you discuss the risks and benefits of starting a combination oral contraceptive with your physician. Now, one of the main downsides of using contraceptives as a method of treating acne is that they often take 3 to 6 months to take effect. While we're waiting for the oral contraceptive to take effect, I'll also make sure that the patient is on a good topical regimen. Usually this includes a benzoyl peroxide wash as well as a topical retinoid. Overall, combination oral contraceptives are a great option for the treatment of acne. They have a favorable side effect profile when used long term, and if a patient's going to be on that method of birth control anyways, or is looking into different forms of contraception, you can kind of kill 2 birds with 1 stone if you use the combination oral contraceptives both for contraception as well as acne treatment. Now, often even after a patient has been on combination oral contraceptives for 6 months, we're still not achieving the control of acne that we're looking for. In these situations, it's really nice to add spironolactone to the treatment regimen. Spironolactone is one of my favorite medications to prescribe as a dermatologist because it's so effective. Spironolactone was initially developed as a diuretic and is still used today in the treatment of heart failure and blood pressure. An interesting thing happened in that patients who were on spironolactone for other reasons had dramatic improvement in their acne in many cases. So dermatologists put 2 and 2 together and now use it frequently for the treatment of acne, even in patients who don't have elevated blood pressures or other reasons to be on spironolactone. As we discussed previously, spironolactone opposes the activity of androgens, such as testosterone, on the sebaceous glands in the skin. Because of this mechanism of action, spironolactone is also commonly used for the treatment of hair loss in women. So oftentimes in patients who come in with concerns of both acne and hair loss, you can get the 2-for-1 special if you are started on spironolactone, because it will often help with both of those conditions. Spironolactone is a pill that is taken once daily at bedtime. Now, the reason I advise patients to take their spironolactone at bedtime is that one of the most common side effects is a little bit of lightheadedness if you sit up all of a sudden. For instance, if you're lying flat and then sit up very quickly, you might notice you're lightheaded for a moment or 2. This lightheadedness tends to improve the longer that you've been on the medication. The body adapts to it over time, and so it's a symptom that tends to become less bothersome as the weeks go by. Now, typically when I'm starting a patient on spironolactone, what I'll do is I'll have them start at a lower dose of 50 milligrams per day. Now, if they're tolerating the medication well at 1 week, I'll double the dose to 100 milligrams per day. 2 of the most common side effects of spironolactone are menstrual irregularities and breast tenderness. If a combination oral contraceptive has been started prior to starting spironolactone, oftentimes these side effects are reduced significantly or don't occur altogether. Sometimes patients will report nausea, a mild headache, or fatigue after starting spironolactone. These side effects tend to improve with time, and it's fairly uncommon that the medication needs to be discontinued because of a side effect. For spironolactone, usually no laboratory monitoring is required, But you should tell your doctor if you have a history of kidney disease, because sometimes in those instances we'll check a potassium level. Now, similar to combination oral contraceptives, it does take some time for the spironolactone to take effect. Usually most patients will notice a decrease in the oiliness of their skin within a month or two of starting the medication. Typically by 3 months they've noticed some improvement in their acne, but oftentimes it takes up to 5 or 6 months to really get the improvement that they're looking for. Oftentimes I'll start an oral antibiotic at the same time that I start spironolactone. This is because the oral antibiotics usually only take a few weeks to have an impact on the patient's acne, whereas the spironolactone takes at least 2 to 3 months to kick in. In addition, when a patient's on spironolactone, similar to the oral contraceptives, it's still important to optimize the topical regimen. If a patient isn't experiencing the improvement in acne that they want while on spironolactone, there are a few options to be considered. The first option is that it's important to make sure that the dose of spironolactone is high enough to see an effect. If you're only on 50 milligrams or 100 milligrams a day, there's some more room to work usually. I'll often have patients up to 150 to 200 milligrams a day before we're seeing the improvement in the acne that we need to see. When patients are already at the maximum dose of spironolactone, but we still haven't improved acne as much as we'd like to see, that's usually when I'll start encouraging them to think a little bit more about isotretinoin or Accutane. Another nice aspect of spironolactone and combination oral contraceptives is that they can often be started during that initial visit. With isotretinoin, there's a little bit more monitoring that goes into starting that medication. I've had many patients in my practice who have had very good results for the treatment of their acne after starting a combination oral contraceptive or spironolactone. If you are currently struggling with hormonal acne, I'd encourage you to talk about these two options with your dermatologist. If you have any questions about either combination oral contraceptives or spironolactone, please leave a question in the comment section below and I'll do my best to either get back to you directly or address the question in a future video. As always, if you found this video helpful, please like and subscribe to my channel because it really helps me make more content like this. Thanks for watching and have a great day.